move on with lateral stenosis in the cervical spine, also known as foraminal encroachment. Everybody's seen patients with foraminal encroachment. They have kind of a forward head posture. They have maybe a bus drive or something like this. Maybe pain in the shoulder or their arm, and every time they put their head back, ow, ow, they feel the pain going down their arm. Might be motor weakness in the arm as well. We're going to pretend that she has a foraminal encroachment on her left side. Now you can put your hands at your side now. All right. Most often, the foraminal encroachment in the cervical spine is in the lower cervical, C5, C6, C6, C7. We have this kind of a forward head posture like this. All that stress puts the excessive weight on the lower discs. Degeneration happens in there. Joints of Lischka, the uncinate processes of the vertebra curl over into the intervertebral foramen. And traction, I'm bending away. I'm trying to drive her head in that direction. And I'm driving with my legs. Pressure on, pressure off. You all right? I start very slowly. Not that hard, not that much force, because they want to monitor how the patient responds and get them used to it. Pressure on, pressure off. Pressure on. You all right? Pressure off. I'll do the other side once or twice. You can apply quite a bit of force. You can use a fair amount of force with this procedure, but it all depends on the patient's response. Can I go more hard than that? So she said I can go a little harder. Okay. You all right? Mm-hmm. I'm actually asking her as I'm doing the procedure. Pressure on, pressure off. You can have an assistant with this, and they would pull down the arm at the same time. So they'd pull down the arm the same time as I'm lifting on the head. Patient most often, if this is the cause, patient most often will feel warming or tingling sensation down the arm, and they'll feel some relief. Now, all spinal stenosis you're not going to be able to help. Obviously, if they're gone too far, lumbar stenosis, where you have this cauda equina syndrome or terrible pain in their legs, if it's gone too far, you can't help them. Some foraminal encroachments in the neck, you can't help. You can try, but there's no, it's still sore. Well, it might be so bad they need to have an operation. But at least these procedures, it's a safe way to tell. And if they do respond, well, that's great. You know, if you have a grandparent that comes in and they have this neurogenic claudication where they can only walk maybe a block, where their legs get really heavy and they have to sit down, if you do this procedure and you pull their legs and they can walk maybe a quarter of a mile or a half a mile from that point on, well, that's really a change in their life. With their grandchildren, like the happiness with the grandchildren or the activities they do during the day. So it's actually very worthwhile trying the procedures on these people with stenosis.